What is an anatomical section in anatomy? Have you ever wondered how doctors and scientists study the human body in detail? One of the key methods they use is through anatomical sections. So, what exactly is an anatomical section? An anatomical section is a flat surface created when a three-dimensional body or organ is cut along an imaginary plane. This technique allows us to see and study the internal structures that are usually hidden from view. Understanding anatomical sections is essential in the field of anatomy. It helps visualize how body parts are organized and how they relate to one another. The body can be divided using several standard planes, which serve as references for making these cuts. First, we have the sagittal plane. This plane divides the body into right and left portions. When this plane runs exactly down the midline, creating equal halves, it is called the mid-sagittal or median plane. If it divides the body into unequal right and left parts, it is known as a parasagittal plane. Next is the frontal plane, also known as the coronal plane. This plane divides the body into anterior, which means front, and posterior, meaning back portions. Then we have the transverse plane, which is sometimes referred to as the horizontal or axial plane. This plane divides the body into superior, or upper, and inferior, or lower parts. When we make a cut along this plane, we produce cross-sections that reveal the internal layout of the body. When a body or organ is sliced along one of these planes, the resulting flat surface is what we call an anatomical section. These sections are vital for studying internal anatomy in a systematic way. They are also widely used in medical imaging techniques like magnetic resonance imaging and computed tomography scans. These technologies create virtual sections without physically cutting into the body. Understanding anatomical sections is also important for describing the locations and movements of body parts. It plays a significant role in surgical planning and anatomical education. For example, a transverse section of the abdomen can show the arrangement of organs like the liver, stomach, and intestines. This helps clarify their positions relative to one another. In essence, an anatomical section is the visible surface obtained by cutting through the body or an organ along a specific plane. This technique enables a detailed examination of internal structures and supports the study of body systems and organ functions.